Hello, this is Cindy Kelly from Houston Enzymes. The topic today is the role of enzymes in autism, food intolerances, and gut issues, presented by Dr. Devin Houston. Welcome, Dr. Houston.
Welcome. I'm glad to be here. And
You,
I guess we'll just get right to it.
yep, we're ready.
Okay. Um, Again, thanks for taking time out of your day to attend this webinar. And I hope it's uh, informative. And I do have a list of questions I've received from many of the listeners in advance. And we should be able to get those. And if I don't specifically address them during the presentation, then at the end we'll take some time to do that. So yeah, you're here today because you are interested in how diet, food, and GI issues, what their role is in your child's autism. So we're going to get to that. Um, As many of you know, there's many digestive problems in autism. And in the last couple of years, there's been a flurry of studies done where uh, researchers have shown that kids on the spectrum have problems breaking down carbohydrates, proteins, starches, fats. Um, and a lot of these GI problems are actually related to the behavioral problems, which kind of makes sense. If your kid's having bloating and cramping after a meal, then especially if they have trouble verbalizing their pain or discomfort, then that can present as um, problems in behavior. They act out or they become aggressive and such. So definitely there is a problem with the breakdown or how foods are broken down. Now, we're going to be talking about how enzymes work in this. And keep in mind, and we're going to go backtrack, and the way this works is sometimes I'll talk about things and then come back and define them or clarify certain things. But um, enzymes break down foods. And what got me interested in autism and enzymes years and years ago was the fact that how certain food proteins like gluten and casein um, cause such strange reactions in children when the way that they break down these proteins is the same way that we all break down proteins. So what's what's actually causing the problems? And this we can also talk in terms of autism, but we also need to keep it in the realm of food intolerances, which runs it's a spectrum itself. We have things from as mild as heartburn and reflux to celiac disease. So all of those relate some way to some type of food intolerance or just eating something that doesn't agree with you. And there could be multiple reasons why we have these problems. Sometimes it's simply the absence of an enzyme needed to break down food. For example, lactase is an enzyme that's very prevalent in babies because they nurse, the milk is their primary food, so they need the enzyme to break down the milk sugar, lactose. After about age 5 or 6, kids are on solid food diets and their milk intake goes down, so that particular enzyme, lactase, is genetically programmed to slow down. And so by the time we hit our 30s, many of us are lactose intolerant, and we drink a glass of milk or have a bowl of ice cream, and we're in trouble. We have the cramping, diarrhea, and gassiness associated with lactose intolerance, and that can be simply remedied by taking a lactase enzyme supplement. But there's other things like irritable bowel syndrome. And while inflammation is the causative feature in IBS, what causes the inflammation? Is it reaction to a certain food, certain protein? Is it bacterial? We're all not sure. We can give you drugs, and there's some uh, things that we can do for the symptoms, but we're not sure about the causative. Food poisoning, that's a type of food intolerance. You just are We're not meant to eat bad food or take in um, pathogenic bacteria like E. coli. Unlike some animals like dogs and cats, they can eat a considerable amount of rotten food or bad food without reacting to it. We can't. Our guts have become sensitized and used to clean food basically. So we react violently to food that's that way. And I've personally been exposed to that, especially when you travel different parts of the world or eat out a lot. That can happen. Food additives. People can be sensitive to artificial ingredients, artificial colors and dyes. Stress or psychological factors. Anyone who's been severely upset or going through a really um, tough time emotionally, this can be reflected in the gut. The gut really reacts to our psychological moods, and it can have a real effect. And of course, celiac disease, which is a reaction to gliadin protein found in wheat. That's an extreme case of food intolerance. In autism, though, we can kind of restrict that to different categories. And I'm sure many of you have heard several things that we're going to talk on, but just to reiterate, we have problems with wheat or gluten. And it's not the gluten itself, it's the peptides that result from the partial breakdown of gluten. The same thing with casein, producing peptides. But what about things like blueberries or strawberries or different fruits and vegetables? Well, in that case, we're not talking about proteins as much as we are maybe polyphenols, which are good compounds, and we need those in our diet. But for them to be active, our gut is supposed to remove a sugar group from the polyphenol, which activates it. And when this doesn't happen, we can't absorb the polyphenol, and this can sometimes cause a histamine release, which results in the red cheeks and the red ears that we often see in these kids. And this may be remedied by different enzymes. So again, let's go to defining what enzymes are. These are specialized proteins that cause chemical reactions to occur under conditions that are suitable for life. Now, we can go to the lab and we can break down gluten or casein. We can put it in a vial. We can add very strong acid like hydrochloric acid or phosphoric acid and put that under high pressure and temperature for 20 hours or so, and we can break down that protein to its constituent amino acids. But of course, our digestive tract doesn't rely on very strong acid and high temperatures. So what we do is we utilize enzymes, and they can perform the same reactions but do it at room temperature in water and under conditions basically that allow us to live. Now, the cool thing about enzymes is that while they cause chemical reactions to occur, they themselves are unchanged. They're not used up during the reaction. So a molecule of enzyme can do a tremendous amount of work. As long as it keeps interacting with whatever it works on, like lactase working on lactose, as long as there's lactose around, the lactase enzyme will keep breaking down that lactose sugar to, or that lactose disaccharide to simple sugars. Also, enzymes are very, very specific. They usually work on one reaction. So that's why we have thousands and thousands of enzymes within our bodies, because we have all these different reactions. So we've devised different enzymes to work for each reaction. Now, many of the enzymes we have in our bodies are metabolic. They're in cells, within specific organs. You can't really take a pill and have that particular enzyme go and replace, like phenylketonuria or PKU, which is a genetic inborn error of metabolism where you can't metabolize the amino acid phenylalanine. You can't replace that enzyme orally and hope for it to get inside a cell or the specific cell in your liver that would be required to help you break down phenylalanine. So we're not going to be talking about metabolic enzymes. However, digestive enzymes, those that are designed to break down the food proteins, carbohydrates, and fats that we ingest and are in our GI tract, these we can talk about. So we're going to be talking about the pancreatic enzymes, which we call animal-based, because you can get these as oral supplements by prescription, but they're extracts from the pancreas of pigs or cows, and they are standardized, and they are very powerful, and they have a use. They are very useful. But enzyme supplements that you can get over the counter without prescription are going to be what we call plant-based. Some of them come from fruits like bananas and papaya, but the bulk, I'd say 95% of enzyme supplements are going to come from fungal sources. And I know that's the F word in with parents with kids on the spectrum, but there are good fungus and bad fungus, and the fungus that produces enzymes are what we call the good fungus. So we're going to get into how they're made. There's a couple of enzymes also from bacterial sources as well, such as the Serratia peptidase, which is from a bacterium called Serratia marcescens. We take enzyme supplements. We want to complement restrictive diets, or basically the diets that you've heard about, like GFCF or the paleo diets or SCD or such like that. You can add in enzymes to help those diets work better, or even sometimes be an alternative to those diets. They can address or work on the foods that are missed by diets, as well as increase how well the diet works. We've been doing this now for almost 15 years, and we've heard so many stories from parents about how the enzymes can help do just as well as a diet, and in many cases even better. So, and that tells us that what the enzymes are doing are similar to what the diets are doing. Basically, instead of eliminating those proteins that cause problems, we're just changing those proteins. We can address enzyme deficiencies such as lactase or lactose intolerance. But what I really want to emphasize, and what is not being talked about a lot among different enzyme companies, is that the enzymes we're going to be referring to, the fungal-based enzymes, are acid stable, unlike pancreatic enzymes. And this means that they can actually work in the stomach. They can, and this is a whole different paradigm. In the stomach, there's not a whole lot that goes on for digestion. It's basically a mixing area and a holding area for the food to become mechanically broken down so that the texture and the consistency changes to where the enzymes from the pancreas can work on the food better. So there's not a whole lot of breakdown occurred, but these acid-stable plant-based enzymes can work in the acid environment of the stomach. These enzyme proteins are stable. They actually work better under acidic pH than many other proteins. So they start the chemical breakdown of food much sooner, and we can show later on how this helps. Now, if nothing else from this webinar, please take this message home. The enzyme supplements are extremely safe. You can take a handful of enzyme capsules. There's no toxicity at any dose that has been found. They can provide benefits to anyone, but there's no side effects. The enzymes, a small amount can be absorbed into the system if you take a whole lot of enzymes and take it very frequently. But for the most part, 97, 98% of the enzyme you take is going to stay in the gut. And the nice thing is, if the food that you are hoping for the enzyme to work on, if it's not present, it doesn't do anything. It can't just suddenly go out on its own to do something else. So they're well characterized. So we know what they do, and we understand enzymes very well. Now, one thing we do know, you've heard a lot about DPP-4 and such, and my problem is with this, and I'm the one that actually found the DPP4 to be present in commercially available enzymes back in '99. And a lot of people made a big deal about, oh, having DPP4 present in your enzyme supplement. And it is. It's a really cool enzyme because it it makes a nice story for for what it does, especially for the digestive problems suffered by um, children on the spectrum. But what I want to emphasize is that multiple proteases are necessary to completely break down food proteins. And we can't rely on any one protease like DPP4 or any other one. So it's just not sufficient to do the job in the time we have to work on food during digestion. So adding these other proteases, which are enzymes that break down proteins with different peptide bond preferences, or the ability to break down the bonds between different amino acids within a protein. This ensures that we get complete breakdown. And these proteases have different profiles than what the pancreatic proteases provide. And there are many labs in many countries looking at very similar enzymes that are available in some supplements. They're looking at possibly using it as a drug for celiac disease. So to me, this says that a lot of mainstream scientists are looking at fungal and bacterial enzymes as potential therapeutic agents to help in such drastically severe diseases such as celiac disease, and that possibly FDA may even approve such enzyme cocktails as a potential treatment. Here we have, and those of you who've seen my presentations before, I've kind of streamlined this and just so we can emphasize things that I think are really important. But right here, I want to show how enzymes can help in breaking down proteins like casein or gluten. And here we have a portion of the casein protein represented, and all these X's are amino acids, but we're not really interested in those particular ones. But there's a sequence embedded within the casein protein, a tyrosine proline, phenylalanine proline, glutamine proline, and isoleucine embedded within this chain. And this, I'll just tell you from the outset, this is the structure of casomorphin, the exorphin peptide or the opiate-like peptide derived from casein. Now, when it's within the casein structure, it's not casomorphin. It won't act like an opiate. But what happens and this occurs in all of us, in normal digestion, it encounters, if you eat a piece of cheese or eat some ice cream with casein in it, it's going to encounter, though, the one protease enzyme in the stomach, which is pepsin. And pepsin is a very particular enzyme, and it likes to break this peptide bond right here between this tyrosine and whatever this amino acid is. And when you do that, you've clipped or you've changed the casein molecule. It's really not casein anymore, but you've got potential structural changes going on. And if we wait a couple hours and the food leaves the stomach, and let's see, let me get that back. Oops. And it encounters the pancreatic enzyme elastase. And elastase is another protease enzyme, and it likes to work on that particular peptide bond. So what it's done, it's released a peptide from the casein molecule, and this is casomorphin. And so this has happened in your small intestine, and this small peptide can now be absorbed out of the gut into the systemic circulation. And it may be why for some who like a glass of warm milk at night, it may help you sleep, because it's an opiate. It's like a little bit of morphine. Not nearly as powerful, but it still has an effect. So that's all well and good, but why do kids on the spectrum react to casomorphin or other exorphin peptides? We don't really know, but their actions are very different from neurotypical people. So we're not sure what's going on, but we do know it seems to be something that happens. Now, I mentioned DPP4. That stands for dipeptidyl peptidase and it's number 4. There's a family of dipeptidopeptidases, and this happens to be number 4. It's a very interesting enzyme in that it requires a specific set of rules for it to work. And we're just going to show the casomorphin peptide here because this was the key to that actually caused me to get into the whole autism community, was the fact that this is a peptide, or this is a peptidase that is produced in the gut and within cells in the gut, and it's the only known enzyme known to break down exorphin peptides like casomorphin. And this is how it works. It has to work on this. I'm going to back that up again. This DPP4 only works if proline is the next to the last amino acid on this end of the peptide, and there has to be whatever the last amino acid is. It can't be attached to anything else. It's what we call unblocked. So if that happens and proline is the next to the last or the penultimate, to use a big word, amino acid on this end, DPP4 can break off in sets of 2 amino acids. That's why we call it dipeptidyl, meaning dipeptide. It produces a dipeptide. But it does that by cleaving this bond right here. So what you've done, you've changed the casomorphin molecule. When you change structure, you change function. So this isn't quite, it's not going to work quite like casomorphin. But look what's left. We have the same scenario for DPP4 to work. A proline is amino acid is next to the last. The last amino acid is unblocked. It's not attached to anything. So it can actually go ahead and remove another 2 amino acids. And here again, the same thing. So because of a particular structure of casomorphin, DPP4 can really just knock the socks off of it and just tear it apart. It completely obliterates it. So there's no more casomorphin. Now, let's see what happens. Again, we got our casein amino acid, and let's see how it's affected by DPP4 in the stomach. Your child has gotten a hold of a block of cheese and ran off and ate it, so it's got all this casein in its stomach. So what's happening? Well, you have pepsin in there, and it does its thing, but you happen to remember to give a enzyme supplement that contains some DPP4. So what's going to happen? Well, the pepsin happened to break down the casein right there. In this case, now all the requirements are met for DPP4 to work. We have this unblocked, and DPP4 can just go to work on it. Just like we showed earlier, and this isn't even casomorphin yet because it's still attached to the rest of the casein molecule. So what DPP4 is doing is it's defusing or preventing the formation of casomorphin even before it becomes casomorphin. So it's just what I call defusing the bomb, the casein bomb in this case, but it'll work on gluten, soy protein, other peptides that have the similar structure. So by the time the food leaves the stomach, there's no casomorphin there if there was enough DPP4 to work on the amount of casein in there. But that's kind of tricky, just relying on one enzyme. And DPP4 is actually not a standardized enzyme. You can't buy that from my manufacturer or any other manufacturer. It's what we call as a side activity. It's an undocumented activity, and the growers or the people, the manufacturers of the enzymes, companies in Japan that produce these through fungal fermentation techniques, they're not interested in developing a fungal strain or producing an enzyme standardized on DPP4. But it just happens to be there among some of the proteases they do standardize on, like protease 4.5 or protease 6. I include those because those are commercially available proteases available to us and other companies as well. So while DPP4 is all well and good, I'm not completely confident in relying on it alone. So there's another way around this whole thing. Different proteases have different cleavage profiles, whereas they cleave at different parts of any protein. So here, you got the casein in the stomach again. The acid in the stomach denatured the protein, or basically unraveled it to where it's linear so that the enzyme molecule can get to the different peptide bonds. Let's pick protease 4, but this time you took say an AFP peptide or some other high protease enzyme that contain not only DPP4 but other proteases as well. So what happens in the stomach? Well, protease 4.5 is much less particular or much less specific in what it cleaves. So it happens to like this bond right here between the phenylalanine and proline, and it'll clip that right there. Now, can you, based on what I've told you, can you see what's happened? Again, this is in the stomach. Casomorphin's not been formed, but you can see there's no way from this particular molecule of casein, you can't get a casomorphin now because we clipped it, or the protease 4.5 clipped it right in the middle of where casomorphin would have been formed. So really it doesn't matter what happens from here on out. This particular molecule will not produce casomorphin. But we also have protease 6.0, which is different from 4.5. It breaks down different amino acid or peptide bonds. In fact, it likes this one right here. So it goes ahead and clips, and it would have done this regardless of if 4.5 hadn't worked. It would have gone ahead and posed it. So there's two ways to break down the casomorphin, or to keep casomorphin from being produced. So whatever happens here on out is moot. Even elastase downstream in the small intestine, it's going to do that, but it's not going to produce casomorphin. You're just not going to produce it. So that's a different way. And you can see we didn't even have DPP4 in the picture. Now, here's the big thing. I'm a biochemist, and I've studied enzymes since 1981, even in grad school. I was working in a lab that looked at purifying and characterizing different enzymes. And one thing we were told over and over again: structure determines function. And here's an analogy. Let's take the word mother. When I say mother, and I'm sure there's many moms out here listening, but that you get a picture. Here's a mom holding her baby, and so that's a picture. This word denotes a person. It has meaning. If we change it, say remove those two letters, we have a totally different picture. We have a moth. Well, same thing with proteases. If we change the structure, we change the function. So I'm going to get through all this again. Just to the analogy, just proteins are made up of amino acids, which are like the letters in a word. So when you change the letters around, move them around, delete them, you get a different word. Or you get it, in this case, you get a different peptide, different protein. And we're just going to keep going just to illustrate. Change the structure, you change the function. So we don't have casomorphin anymore. And the nice thing about the enzymes, they don't really care if it's any protein. I mean, where the protein came from. As long as it's denatured and the enzyme has access to that particular peptide bond, it's going to work. All right. Okay, well, that's proteins, and that's all well and good. What about carbohydrates or starches? Well, there's been several studies, notably done by Tim Bowie at Boston General, or Mass General in Boston, showing that a lot of children on the spectrum seem to have a low amount of disaccharidase enzymes. And disaccharidase enzymes are enzymes like lactase, again, that break down they're not complex carbs, but they're disaccharide carbs. And if you don't break these down, different bacteria and yeast feed on the carbs. You know, your mom always told you don't eat a lot of sugar because the yeast or the bugs in your gut will just cause them to bloom. Well, that's not really true. Sugar is rapidly absorbed out of the gut. What bacteria do like to feed on, though, are the carbohydrates laying around that are not broken down. This is what happens with lactose, why you get all that bloating and gas. Lactose not being broken down is something that bacteria love to feed on, and the more they feed, the more they reproduce, the more gas they produce, and that's what happens. Also, the watery stools are because as the sugar stays in the gut, it pulls water into the gut, making it more loose. And when sugar leaves the gut, it takes water with it. So it's a good thing for sugar to leave the gut, as it tends to dry out the stools. Different carbohydrates work on different, or different carbohydrates enzymes work on different carbohydrates. Amylase and glucoamylase are the two that we depend on to help break down most starches. Other enzymes like lactase can be helpful, and these also are very helpful in firming up loose stools. Just this year, I did a quick search, and there are several articles talking about the GI problems in kids, and this is true. This is not just a theory or wives' tales or just something in parents that are imagining. This is now established that kids on the spectrum with autism often have chronic GI problems. In this one study, they looked at 164, it was published in Autism Research this year, or back in April. They looked at 164 children that were on the spectrum. 49, half of them had chronic GI complaints. Which means it just wasn't every once in a while. They had every day or just very often GI problems. 22% had diarrhea, 26% constipation, bloating, gasiness, reflux were in about 10% of the population of these kids. Now, carbohydrates enzymes. Again, they've been out for a while, and many of you have had experiences with them. So what they do is they're going to break down the starchy foods. Fibers are starches as well. And the different fibers, some fibers are more resistant to break down, and some are totally oblivious to being broken down. And they're what we call the bulking agents. And they're the ones that provide bulk and roughage to help move things and keep things cleaned out in all the little valleys and cracks of the intestinal tract. So what carbohydrates enzymes can do is they break down not just the starches, but often some of the fibers as well. Maybe just a small portion, turning what we call non-soluble fiber into solubilized fiber. And this is okay. This can actually produce this kind of a gel that mixes with the stool and makes it softer. So that's okay. But it can also decrease the bulk. And a lot of people say, well, if I take these enzymes, I often get constipated. Well, not really constipated. What happens is you're breaking down more of the starch, and starches can make up to 60 to 70% of any typical meal in the Western world. We eat a lot of starches. So if you're breaking them, if you're taking enzymes, they're going to break down those starches more, or more of them is going to be broken down. So this decreases the amount of material within the gut, or that you're going to pass through. The enzymes also, by breaking down the starches into simple sugars, which then leave the gut, this removes water from the gut, which is going to make drier, smaller stools. And more food's absorbed, less eliminated as waste. And this could cause constipation to appear worse, but it's not really causing constipation. It's, for an analogy, the gut is a tube, but it's a flexible tube, and during digestion, it's a very muscular organ, and it contracts, and this contraction causes what we call peristalsis, or movement. It wants to move the food along the 25 feet of the intestinal tract, to push it along, and Um, but to do that, the stool or the feces have to be in contact with the gut wall. Now, if your child has problems with constipation or holding feces, he may have megacolon, or it may have stressed out his gut, or he just may have low tone, what we call dystonia, or low tone of the gut, where it just doesn't move as much. So now, if you're taking enzymes that break down the starches better, you have less mass. Maybe the feces aren't they're just on the bottom of the gut. They're not being completely enclosed by the gut wall. So it's harder to move along. And so you just don't have the bowel movements you did before. And so what we suggest is taking carbohydrates enzymes like Zyme Prime or Zycarb. You need to take plenty of water to keep water within the stool mass. Try to add fiber, celery or carrots, or even guar gum, or other fibers. Psyllium is a little can be problematic. Certain fibers can cause gas, which is socially not convenient. But there's other ways around that. So just keep in mind that this is something you see, and sometimes it's like putting a BB in a large PVC pipe. It's just hard to move small amounts. So, but you can avoid this, or you can adjust it by the dose of the enzymes you take. So if this is a problem, just take less enzyme, or don't take it as frequently. Um, I have a picture of our no-phenol enzyme product. This is to remind me to talk about the enzymes for polyphenolic foods. This has a very interesting story behind it, which I'll briefly summarize, but a lot of the parents were finding good results with the AFP peptide and Zyme Prime. And many of them said, hey, we noticed my kid can now eat oranges or strawberries without getting the red cheeks and red ears or the hyperactivity that we'd seen previously. Is there something where you can improve upon this? So it got me looking around, and I found a particular enzyme that seems to stand, when I tested it with a number of parents, and it stood up head and shoulders over all the other enzymes. So we based no-phenol upon that. And some reason, and we're not understanding why it helps, but it relies on a particular enzyme called xylanase, which breaks down xylans, which are the structural elements in plant cells. And you see this in a lot of raw foods and fibrous foods, which can be hard on the GI tract, but the xylanase tends to break those down. It's in the cellulase family, as is glucanase, and they can help break down the fibers, which adds softening or gel to the stools, and that can kind of counter some of the constipating effect of the other enzymes like amylase and glucoamylase. Why it works on highly colored fruits and veggies, we're not really sure. I've got a theory based on some of the medical literature I've seen on enzymes, but it's really not something I can say hard and fast. But this particular enzyme, xylanase, seems to work on colors. So it may be the actual natural colors in these fruits and vegetables that are causing the problem, and the xylanase simply helps probably removing some sugar groups that are attached to those and allowing them to be absorbed. But very interesting that it works that way. Also, just as a side note, kids on the spectrum may react more so to natural colors than artificial colors. So I know everybody wants a natural product, but consider if your kid does react to certain natural food colorings, that maybe an artificial coloring is not so bad. Again, it depends on a particular one, and I don't want to get a rap for advocating artificial dyes and such, but again, for any particular person, that that may be an alternative. Though for the time being, we're going to keep natural uh, colors and flavors in our chewables. So even adults have noticed that the flushing effect seen with certain wines, or the red face, red ears, or the um, just the histamine reaction that seems to occur with certain beers and wines, can be remedied with the no-phenol. So interesting. I think it just goes just along with the same thing. A lot of these wines have deep colors, like the Merlots and Chardonnays. Um, and they're highly polyphenolic. So the no-phenol is probably just helping remove those sugar groups. In fact, it doesn't break down phenolics. It just allows them to be activated by removing that sugar group. So it's a good thing. It lets those good polyphenolic compounds get into the system and work. Um, Xylanase enzyme, if constipation is a problem with the other enzyme, you can add this to it and kind of balance out the stool forming action. So keep this in mind as well. It may be something you might want to experiment if enzymes are helping, but you can't deal with the stool forming effects of the other enzymes. Now, I want to get to the end here so I can address some of the questions and not take up all of your time. But how do you choose an enzyme product? You try to match a particular dietary problem to the enzymes that's needed. For example, if you knew you were lactose intolerant, you would take a lactase enzyme. In the same way, if your child has a problem with food proteins, take a high protease enzyme problem. That may be all the enzymes he needs. Or if it's to particular carbohydrate, take an enzyme product high in carbohydrates enzymes. Sometimes you just don't know, and that way you could take a broad spectrum product like our Trienza, which is a mixture of our AFP peptides, Zyme Prime, and no-phenol in a particular ratio. But you can always mix and match different enzymes depending on your particular diet. Try to take the enzymes at the beginning of a meal. This allows time for the capsule to dissolve. The enzymes aren't going to do anything as long as they're still in the capsule. And they have to be dissolved. They have to go into solution. So it takes less than 30 minutes for the capsule to dissolve. The enzymes go right into the solution in the liquid in the stomach, and then they can start working on the food. So some parents find good results if they take the enzymes 20 minutes, 30 minutes before a meal. Some find it doesn't make that much of a difference. Just take it at the beginning of the meal. Even if you forget and you've already had the meal, remember there's still 2 to 3 hours that the food's going to stay in the stomach. So during that time, the enzymes can be working on it. You may need to take more because you have less time before the stomach contents move into the GI tract. Remember, nothing is really, or very little is absorbed in the stomach. You don't have peptides or proteins absorbed. You have water, alcohol, B vitamins, sugars can be absorbed from the glucose, can be absorbed from the stomach, and some drugs like aspirin. But other than that, not much absorption occurs. So it's what I call a safe area. It gives you time, a window of opportunity. If your kid has eaten something that he shouldn't have, then possibly an enzyme can work on it during that time before the stomach empties, and you can basically defuse the situation. Or, just like with the casomorphin or the glutamorphin, break it down before it gets into the small intestine where all bets are off. And that's why pancreatic enzyme supplements wouldn't be appropriate for digestive problems, because those pancreatic enzyme supplements aren't going to work they're not acid stable. They won't work, and they won't become active in the stomach. They won't be active until they move into the small intestine, and that's too late for when you're dealing with things like exorphin peptides and such. Nice thing with enzymes is we know how they work. They only work on proteins, carbs and starches and fats. So most medications or supplements don't fall into those categories, so they're not going to interfere. And enzymes don't build up in the body. They stay with the meal that you took the enzyme with. So the enzyme you took for breakfast is going to stay with the breakfast as it moves through the gut. So by the time lunchtime occurs, you'll need another enzyme to help with that meal. But the thing is that the enzyme is going to work the first time you take it with the meal. So it's going to work on the first meal you take it with. Look at the supplement facts label. That's where you can put just about anything on a product on a label, but what goes in the supplement facts box is very important, and FDA really looks at this. This has to be true. But if you see this with an enzyme product, just milligrams, that's really not telling you or guaranteeing you anything, because 286 milligrams of protease or pancreatin, vegetable analog, that could have been put in an oven and cooked at 500 degrees and killed off. It's still 286 milligrams, but it's not active. So, and the proprietary blend, and a lot of people go to this because they don't want other companies knowing what's in that. But still, and I can understand why. But really, as a parent of a child that may be sensitive to different foods and different supplements, you really want to know what's in there. And Houston Enzymes will tell you what's in every blend. It's listed there on the label. And this is what you want to see. You want to see every enzyme listed, and you want to see these weird looking abbreviations, HUT, XU. But you may not understand what it is, but means that we're guaranteeing this has to be true, that this amount of activity of this peptidase has to be in one capsule. So this is your guarantee that the enzyme is active and going to work. Well, that wraps up what I have to say today. I want to quickly get to some of the questions. One wrote, would it be beneficial to use a Vitamix that breaks down food to a cellular level along with digestive enzymes? Well, that's basically what your stomach is going to do, but that's the first step in digestion is mechanical breakdown. And a Vitamix isn't going to break it down on the cellular level, but it will break it down on a macro level. So instead of a chunk of apple, you're basically dealing with apple sauce. And yes, this increases the surface area and allows enzymes better access to the food. So yeah, if your child doesn't chew properly or doesn't chew enough, then using a Vitamix and making a slurry just helps the enzymes that much more. What about probiotics and prebiotics? What amounts to use? There's no doubt that probiotics are helpful. The question is, which one? Now, you're going to hear a lot at conferences and in the literature, you're going to hear a lot of people talking about the microbiome. In fact, I'm going down to a conference in Little Rock next week, put on by Dr. Richard Fry at University of Arkansas Medical Science. The conference is all about the gut microbiome, which is a fancy word for the gut environment. And we now understand that everybody has a different makeup of gut bacteria. And this gut bacteria actually communicates with the rest of the body, especially the brain. So it's very important. Everyone has a different flora, different makeup. And this determines general digestive health as well as immunity. So what you need to find out is which bacteria, which probiotic works in your gut or which should be in your gut. And that's the biggest struggle, because all of us are going to have what works for one person may not work for another. So lactobacillus may work for you, but it may not work for me. I may need a bifidobacteria. So I think in the future you're going to see personalized medicine go that way. Maybe look into your gut or take a culture and find out what bacteria should be there, and then try to get your own bacteria. And this is where prebiotics comes into play. Try to get your own bacteria to grow, because that's what was there in the first place. When you were born, if you had a vaginal delivery, you were inoculated with your mother's bacteria during birth. And so this is what your first exposure, and this is helpful to you. So that you keep that for life. So can we modulate health by changing the gut gut bacteria? Quite possibly. So this is being looked at quite um, uh, succinctly, and there's a lot of interest in the mainstream research world looking at gut bacteria. When to use HCl for promoting stomach acid? I think people get hung up on the HCl thing. HCl does a couple of things. One, in the stomach, it keeps the gut bacteria from coming up into the stomach. You don't want bacteria in the stomach. Um, it also denatures proteins. Denaturing is what happens, for example, when you uh, mix egg whites or add vinegar or lemon juice to egg white. You see a change from a clear liquid to a solid white. You're denaturing the ovalbumin protein in the egg white. Denaturing is the same word as killing. Whatever, you just killed the enzyme or they killed the protein by denaturing it. But denaturing, active proteins are going to be like a ball of yarn. They're going to be globular. When you denature it, it unravels, and that lets the enzymes have better access to the peptide bonds they need to break. So you need HCl for those particular reasons. HCl also jumpstarts your pancreatic enzymes. The enzyme supplements from fungal sources are already active, so they don't need the acid. So I say if it makes you feel better, sure, use it. I don't think for most of us we really need it. And if you have heartburn and reflux and you're on the H2 blockers, which decreases the HCl in the stomach, then definitely take enzyme supplements that are acid stable, because the acid blockers will help your reflux. They don't do much for your digestion except make it worse. But the enzymes added to the blockers will pick up the slack. When you use pancreatic enzymes, in the cases of pancreatic insufficiency or cystic fibrosis, Creon or pancreatin is recommended. However, remember it's limited. It won't start working until it gets into the GI tract. I always recommend, if your doctor goes along with it and he has you on pancreatic enzymes, ask him to also include the acid-stable fungal enzymes, which will start working sooner in the stomach, and it'll complement the actions of the pancreatic or the Creon. Discuss stool testing for enzymes, gut flora, bacteria, and yeast. And, well, yeah, there are labs out there that do test stools. Excuse me. However, by the time, it's not a good idea for enzyme testing in stools, because by the time the stool is eliminated, a lot of the enzymes may have already done their job and not be around, especially when you ship it off to a laboratory. Enzymes only affect gut flora by reducing or increasing the amount of food available to the gut bacteria. But stool testing, you can take that up with your doctor, and there are labs that do that. How long for healing to occur and for food sensitivities to diminish? Again, depends on the individual. But a lot of people with a good enzyme product can find results with that first bottle. So I would say, usually from my own experience, people can find results even from a couple of days of enzyme use to a couple of weeks. Okay, let's see what else I have here. Here's another question. I had my gallbladder removed 20 years ago and need to understand what I should be supplementing with. Well, I'm probably going to be joining that club. I'm actually having some gallbladder problems myself. I'm going to see the specialist tomorrow. But here's what I've been recommending. Gallbladder is involved in fat breakdown. You need the bile to eat as a emulsifier or soap for the fat grease. It's just like if you dipped your hand in some Crisco shortening and you're trying to wash it off, you need soap, which emulsifies the fat and lets it come off with water. Same thing, the bile mixes with the fats and allows the lipase enzyme to then break it down. So if you have your gallbladder removed, you're still getting bile. The bile goes directly from the liver into the small intestine. Um, but you're told to stay off or use a low-fat diet, which is maybe good, but I find a high lipase enzyme supplement can help with that. And we do have a product called Lipozyme that is 3 different lipase enzymes and does a really good job. It's been helping me, I can tell you that. Another question. This person's autistic 15-year-old child had high lipase levels during his last blood work many years ago. Um, and he says, my doctor's not concerned. Should I be? Well, no, not necessarily. Again, those lipase levels are probably pancreatic lipase levels. And since lipase is only going to work on fats, there's really, the only problem is if, is the pancreas okay? And that would be my only concern, and I'm sure the doctor would know that. So if your doctor's not concerned, you're probably okay. Would you get much better or optimal results if a healthcare professional that's knowledgeable in enzymes provided guidance to the patient rather than the patient taking the enzyme themselves? Well, yeah. The problem is, and I was told by a doctor just the last conference, that a lot of doctors don't understand how these enzyme supplements help or how they work. And I had the first 2 years of medical school for my PhD training. And the one, we had very little training on nutrition, and there was just one lecture I remember on pancreatic enzymes, and that was about it. So you don't get that much understanding. I'm sure it's changed because that was 30 years ago. But anyway, yeah, it'd be helpful, but often the patients educate the doctor about enzymes. So there you go. After starting Transa, how long will it take before I can start a normal diet again? For dairy, fats, and carbs, it just depends on the person. Sometimes it can help with the first time you take it. Sometimes it takes a few days before you notice changes. Should you change the amount of enzymes as you get older? My son will be 16 and is still taking 2 Transa 3 times a day. Yeah, only in the fact that as they get older, they may eat more or their diet may change, and so you may need to make adjustments. Again, if with larger meals, you may need more enzymes. I would think 2 Transa 3 times per day would be helpful, but if one meal is larger than another, you may need 3 or 4. It just depends. So we suggest that you experiment. If you're not seeing the results you think you should be seeing, then give more. If you're seeing some effects like, slower or, bowel movements that aren't quite, a little bit harder to evacuate, then back off on the enzyme dosing a little bit. What about gastritis and specific indications for people with gastritis? Again, depends what particular food is causing the gastritis. That's an inflammation. Some enzymes do tend to have anti-inflammatory properties, so keep that in mind as well, though we don't really make any health claims for that. Any side effects or addiction? No, you can't get addicted to enzymes except if you're addicted to not feeling bloated or gassy. Side effects? No. Again, there's nothing in there. And I can tell you for a fact that back in '97, when I started taking enzymes, I thought there was nothing wrong with my digestion, but I took them anyway because I was working for an enzyme manufacturer. And I was actually amazed at how much better I felt. Not being tired, not feeling bloated, or I had to lay down for a nap after a large meal. It was rather amazing. So, and I thought I knew everything about the enzymes at that time, but didn't know how they made me feel. Um, one child is autistic and doing a gluten-free, casein-free diet, which enzymes would be best for him. That, again, for gluten and casein, those are proteins that produce peptides. So you want to use a high protease, multiple protease enzyme product, such as our AFP peptide. So an enzyme you can take to help with inflammation and yeast. Um, I can't speak directly to inflammation. What you want to do is look at the cause. What's causing it? Is it a specific food? If it is, then that particular food may be addressed with a particular enzyme. For yeast, you want to address the yeast with an antifungal, but for long term, you want to make sure you're keeping the gut clean, not letting food hang around, which can feed the yeast, also bad bacteria. So again, enzymes and probiotics can be a big help in that. I think that's it. So I'm going to turn this over to Cindy.
Okay, I was just going to interject. I do have a few questions from the audience. If a bottle of Trienza with an expiration date of a year ago has been stored in the freezer, would it still be good to use?
Oh, yeah. Yes. Enzymes love to be cold. So putting them in the freezer just prolongs the stability. So yeah, and we keep in mind we overformulate our products, so we take into account and we do stability testing, and especially the protease is really. We've had bottles of enzymes that were 7 years old and that were out stored in my garage, which is not air conditioned. So they went through the hot, muggy summers here in Arkansas, and they were still had high levels. They were above label claims. So uh, particular enzymes are more stable than others. Lactase is not very stable, so we really overformulate. We put a lot more enzyme than we claim on the label to take into account the fact that it may wear down. But keeping them in the freezer, yeah, if you buy a lot of enzymes at a time, throw them in the freezer. They'll keep much better. Not the refrigerator though. You don't want moisture getting into the capsules because moisture will start the clock ticking. So keep them dry and cold. And if you can't keep them cold, at least keep them dry.
Do you want to mention about the chewables in the freezer too, with getting sticky? I think that's a good tip.
Yeah, the chewables often will tend to discolor if kept at room temperature. We tested them and they're still active. It doesn't affect the efficacy, but sometimes they feel a little softer and maybe the texture-wise aren't so good. So keeping them in the freezer is helpful. Again, the bottle that you're using, I would just keep out at room temperature. But if you bought 8 or 10 bottles, keep the rest in the freezer because the constant pulling it in and out of the freezer, you get some condensation going on there. Ideally, you would take it out of the freezer, put it at room temperature, and let it warm up gradually before you opened it. And that way, that would prevent any moisture from getting inside the bottle. But yeah, if you keep the tablets, the chewable tablets, frozen, you don't get the discoloration.
Here's another one. I feel strongly my 10-year-old son with ADHD on a gluten-free diet for 4 years is casein sensitive. Based on what are you saying it would be more effective to introduce the appropriate enzyme with his current diet, which includes casein, before trying a casein elimination diet? And then she asks, is this correct?
Well, I'm not trying to get people to stop the diet. What I am suggesting, if you haven't done the diet and you're not sure that the diet would work, you can find out very quickly by using the enzymes. The diet, usually they say give it 6 months, and that's a long time to do something to not find and then find out it's not working or you're not doing it right. You can use the enzymes for a month, and if you see improvement, that's a good indication that if you did put them on the diet, you would see good results. But keep in mind that the diet is only restricted for that food that you're removing. So gluten and casein, you're just talking about wheat and dairy. But I can tell you, we then found later that soy protein produces soy morphin, so there's an X-orphin peptide associated with soy. Spinach leaves contain a protein or a opiate peptide as well. So, what are you going to do? Wait, these are the foods we know about. But like I said, the protease enzymes are no discriminator of food. They break down soy morphin or soy protein just as well as casein or gluten. So you can do the diet and add the enzymes to take in all the other foods that we don't know about yet that may be producers of these peptides. Or what a lot of parents do, they find, well, my kid's doing just taking enzymes, so it seems like he can tolerate these foods as long as he has the enzymes. So it's up to you. You're the parent. You make the decision. We try to give you as much information as possible. But for Stacy's question, if if um, if your diet now includes casein, you could add the AFP peptide, and if you see improvements above what you're doing with the gluten-free diet alone, then that's an indication that removing or changing the casein is helping. So that gives you an option. You could go casein free, or you could just continue as you are and just supplement with the enzyme. Again, it's a choice.
Okay, I think that's it for today, and you all will receive a short feedback form. I'd appreciate if you could take a minute after you receive that, if you could let us know what you thought. And if our recording went well, we will post the webinar on our site within a few days, and you will receive an email with the link to the recording. If we didn't get to your question today, call or email us. Thank you all for attending.